Hi, it's Walt Cobb, Mayor for the City of Williams Lake, and we're starting something new here and going to give an update after council meetings. After the 2017 fires, we've gone a long way in trying to FireSmart our community and get grant applications and assist anybody that can. So far, we've been able to get some fire smarting done on South Lakeside, Dairy Road, West Side, Fox Mountain, and the airport. So that's just the beginning. This grant application will allow us to continue with that, and the idea is to possibly look at hiring a coordinator, a part-time coordinator, to make sure we tie this fire smarting all together. One of the things we've been working on is to try and get funding for private properties and assist them. And so far, we've only been able to assist them in getting rid of some of the stuff at the landfill, so there's no charge there. So we've been able to help fund that. But other than that, we will continue to work and see if we can get more funding available for private properties. Another important thing and something that costs us a lot of money every year is our waste reduction. So there's a seminar coming up that's put on by the North Central Local Government Association, but we've also continuing down that road on waste reduction, and that seems to be the key. We've been very successful with some of the programs we've done to reduce the waste that goes into our landfill, because it costs a lot of money to haul it up to Gibraltar Mine. So if we can recycle, reuse, and to do those kind of things, it'll save us a lot of money. Some of the discussions that came up, and these weren't on the council agendas, but they came up as a roundtable after the meetings. And I attended a workshop, fibre supply briefing, not a fire supply, and I got a lot of notes, and there is some areas of concern. As you know, the province is doing some revaluation of the forest policy, but we have lost in British Columbia 100,000 forestry workers since 2001. Some of that comes from modernization, some of it comes from the AAC reduction, fires, etc., etc. But with that, and all indications are, there's the caribou habitat, there's fire, there's transfer of tenure to First Nations, which is affecting the fiber supply. At the end of the day, that fiber supply will end up in the mills probably anyway, so that's not as big a deal. But with the changes that are being anticipated, they feel that we could, in the interior, lose up to 5 sawmills in the next 3 years. And with that, of course, comes not just the sawmills, but our pulp mills, our pellet plants also use the residual wood, and they can't operate without the majors supplying the breakdown of the fiber, because they can't afford to do the logging and the rest themselves. So there is an opportunity or a possibility that we could lose another 2 pulp mills as well in the northern region. So it's a little bit of a concern, and I will continue to work with Kofi and the groups to try and ensure that we look at the economics of it all, when in fact we need to reduce or work on the fiber supply. One of the things that was brought up, and it's still a concern, that we have not accessed or been able to utilize a lot of the wood that was burnt during the 2017 fires. And the comments were that the government should somehow make sure that fiber is utilized first while it's still useful. Get it off the ground, get it replanted, and that will give us a future supply as well. One of the other things that came out of the roundtable was some of the concerns we have with COVID, of course, and the combination of what's happening. We also have a huge doctor and nurse shortage, and I just had a meeting yesterday actually with the Minister of Health, and there's a shortage throughout the province. But as COVID gets worse, the stress gets worse, doctors and nurses are leaving because they're stressed out. It is a major concern, and we have to find a way. Not only do we have to find a way, and we need the help from the province to make sure the education system is such that we are training these doctors and nurses, make sure that we have enough to go around, and open the seats at the universities and colleges so that we can get these nurses and doctors trained. Because as we know, and it's been proven, that anybody that's trained in the north tend to stay in the north, where once they have to go away to school, then they tend to stay away. But not only in the province, but in the Williams Lake area, we have a huge shortage of housing for our doctors. And I've been told of one of the locums that came to town, and he ended up having to live in a basement suite because there was no other accommodation for him. So we have to, our housing study indicated that, whether it be doctors, nurses, teachers, any professional that's come to Williams Lake, we need to find a way to get the housing available. And we actually did meet with the minister prior to UBCM, one of the ministers on housing, and we talked about this specific issue. And there is some plans coming in the near future to deal with more of the homeless side of it, but that will help accommodate some of the other issues that we have to deal with. We had a young fella in Williams Lake that was very gung-ho about making sure that everybody got vaccinated, and he's had a couple of clinics organized now, but there are 5 more coming up that he's been able to help organize. And it was interesting that we worked with him, and we tried to work with him because we were told, as far as TRU nursing program goes, that the shortage of nurses and the shortage of staff is one of the reasons why we haven't been able to get more clinics going on. But we were trying to work with him and work with the TRU and work with Interior Health to get some of those young nurses or nurse training to be able to give the vaccines, and we were told that they can't do that. So although he's been very successful, and there's 5 more clinics coming up at the theater, starting on the 27th of September, going through almost every week, at least close to once a week anyway, until the 28th of October. So we'll put that on our website, so the dates and times will be available. But I think we have to give credit to the young fellow who did all this work and was able to do some things that we couldn't do, because as a local government we end up getting blocked up with bureaucracy. So I have to give credit one more time to the young fellow who initiated this. As I indicated earlier, we've had a couple of meetings prior to UBCM, and one of them was, of course, our prolific offender discussions with the Minister Eby. That went very well, actually, and he's agreed to assist us in whatever way we can, because some of the work that has to be done through the courts and whatnot is federally, but he indicated that he would assist us any way he can to make sure that our message gets across. We did indicate at that time that many of the issues around the prolific offenders is also the health, the medical reasons, the mental health issues, and we did reiterate, and I think he's listening, that a big part of the problem with some of these prolific offenders we need assistance for them when they get out of the system so that they don't continue to repeat. And that was heard loud and clear, and he indicated that he hoped this fall he would have some kind of recommendation for us to assist in that area. It is becoming a major concern, and with my meeting I had yesterday as well, I reiterated that we need numbers, not just for our region, but we need local numbers. We're getting mixed messages, and the people that I talk to are feeling that they are being led down the garden path, in the fact that because we don't get proper numbers of what's happening in our community as a city, that people are saying, oh, well, the breakouts are out in the rural areas, they're not really in Williams Lake. So, but our emergency room is full. They're stressed right out, our doctors, our nurses. The ICU, I'm told, is full we only have 4 beds, and they're having to ship people out. I know a friend of mine is in Victoria, and he's on the ventilator. So it's really crucial that we get the numbers so that people pay attention and start realizing that if you're prepared to get the vaccine, is now the time to do it. So look once again on our website for those vaccine clinics that are coming up. And if you feel the need to be vaccinated, there's a good time. It's after work, it's in the evening. I think they're starting at 7 o'clock. So if you're so inclined, we need to make sure that everybody has the protection that they need to stop this virus.